Imagine this. You've decided it's time to welcome a little one into your life. It's an exciting decision, but it's also one that brings with it a flurry of anticipation and, let's face it, a bit of anxiety. You've probably heard stories of people who conceived almost immediately, and you're hopeful that will be your experience too. But what if it's not? What's normal when it comes to conceiving? Here's a comforting fact to start with. 90% of couples conceive within 12 to 18 months of trying. So if you've been trying for a few months and haven't seen those 2 pink lines yet, don't be discouraged. Now, let's delve a bit deeper into this. Doctors define infertility as the inability to get pregnant after 12 months of regular, unprotected intercourse, if you're under 35 years old. If you're 35 or older, medical professionals will start evaluating your fertility after just 6 months of unsuccessful attempts. So how does this conception process work? If you're having regular menstrual cycles, it's likely that you're ovulating regularly too. This is crucial because you're most fertile in the middle of your cycle, between periods when you release an egg. To increase your chances, make sure to have frequent sex during this time. You can even use an over-the-counter fertility kit to pinpoint when you're ovulating. Here's a breakdown of the numbers. About a quarter of couples will be pregnant at the end of the first month of trying. By 6 months, that number jumps to 50%. Between 85 and 90% of couples will have conceived by the end of a year. Of those who haven't, some will without any specific help. But what if you're part of the 10 to 15% of couples who are, by definition, infertile? Evaluation of infertility usually doesn't begin until a full year has passed. This is because most couples will have conceived by then. However, if you're 35 or older, an evaluation should begin if conception doesn't occur within 6 months. Remember, this is assuming there are no known medical issues that might affect your ability to conceive. If you or your partner have a history of infertility or other medical problems known to cause infertility, such as hormonal imbalances, cancer treatments, or certain illnesses, it might be worth seeking evaluation earlier. So, what's the takeaway here? If you and your partner are healthy, having regular intercourse during your fertile period, and aren't over the age of 35, give yourselves some time before you start to worry. Pregnancy is a beautiful journey, but it's not always one that can be perfectly planned. It might take you 6 months or more to conceive, or it might happen the first time you try. So, take a deep breath, and remember, you're not alone on this journey.